Good morning, everyone, and welcome to today's webinar presentation, Promoting Health, a Reintroduction to Building Healthy Public Policy. My name is Dan Johnson, and I'm an education specialist at Public Health Ontario, and I have the pleasure of moderating today's session. So before we begin, I need to mention a few housekeeping items. To enhance the presentation experience, the chat pod will be enabled throughout the session for discussion, comments, etc. A discussion and question period will follow the presentation. So please submit content questions through the Q&A function at the bottom of the window and not in the chat pod, as questions may be missed there. If you have any technical issues at any point during the session, please email capacitybuilding@oahpp.ca. And lastly, the session will have a different format of 2 presentations, followed by a discussion between the 2 speakers, and then finally a Q&A segment. That's why it's 15 minutes longer. So during the discussion and question period, a poll asking you, our audience, will ask you your thoughts on this new format. It'll pop up on your screens. I'll walk you through it. Please take a moment to vote and provide any feedback you may have. That poll will stay open until the end of the event. So that's poll number 5 if you want to keep track. Okay, so it's now my pleasure to introduce the speakers for today's presentations, Andrea Bodkin and Janet Dawson. Andrea Bodkin has been working in health promotion and public health since 2003 with a focus on capacity building, program design and implementation, partnership, and collaboration. At Public Health Ontario since 2018, Andrea brings her expertise for planning in all forms, evaluation, community engagement, partnership development, and facilitation to public health units across Ontario. Andrea holds a master's degree in public health with a specialty in health promotion from Deakin University in Melbourne, Australia. Janet Dawson has a Master's of Science in Health Promotion from the University of Alberta, a Bachelor of Science in Health Education from Dal University, and currently works as a health promoter at Peterborough Public Health. Throughout her public health career, Janet has led many small and large-scale healthy public policy projects, developed partnership approaches for collaborating with local governments, and coordinated strategies to foster healthier built and natural environments. In addition, Janet has worked as an instructor at the University of Alberta's School of Public Health and was a member of the Fleming College Research and Ethics Board for 8 years. Okay, now all those tongue twisters aside, I'm going to pass it over to Andrea to get us started.
Thank you so much to Dan for that introduction. And I'm really excited to be here and so thankful to have Janet here with me as well. I'm just going to start by telling you a tiny bit about where I am today. I'm coming to you from my home in what is now known as the Don Valley and was originally known as Wascottanach, which means burning bright point, which is a much lovelier name than what Lord Simcoe decided when he decided to change the name to the Don Valley and Don River. So you can see, this is not my picture, but this is pretty much the view from my apartment balcony. And you can see the swath of green that goes across your screen in the middle of that photo. And that is Wascottanach, the Don River and Don Valley. And that river goes all of the way to Lake Ontario and has been home to First Nations people for over 10,000 years. I identify as a white cisgendered settler. All 4 branches of my family came from various parts of Europe and Great Britain and settled here in the 19th century. And I realize that the privileges that I hold today, which are too many to list for you, are a direct result of the choices that my ancestors made, which is why it's so important for me not only to do land acknowledgements, but to learn a little bit about the land that I happen to be situated on, and also hold the 2-eyed seeing teaching, which is with one eye seeing from my traditional Western perspectives, my knowledge and my experience, and with the other eye seeing from an Indigenous perspective and Indigenous ways of knowing. And hopefully I will be bringing that into the presentation for you today. I also need to acknowledge that a lot of the content that I'm presenting today is really from past giants that came before me, in particular Dr. Kim Bergeron, who many of you know. I've worked with Kim for almost my entire career, and she spent several years at Public Health Ontario as well. And also the Healthy Public Policy Community of Practice, which Janet and I will talk about a little bit later, and in particular, Inga Pedra from Peel Region, who has graciously lent me some of her materials. So what we are hoping you are going to get out of today's workshop is that you'll be able to describe the impact of policy on health. You'll be able to identify opportunities for public health to influence healthy public policy, and you'll have an understanding of the steps needed to build healthy public policy. Now, building healthy public policy is a real big thing. If you don't already know that, you will come to understand that very shortly. And it's certainly not the intention that in a 75-minute webinar, you will become an expert, but hopefully you'll have a sense of the scope, you'll have an idea of where you might fit into that scope, and you might get some ideas, and you'll certainly get inspiration from what Janet is going to talk with us about those questions. It gives us a sense of who's on the line and what kind of content you might be interested in hearing about. So let's start off by talking a little bit about what policy is. Policy is a guide to action that is designed to change what is already occurring or what might occur in future. Policy guides decision making, and it sets priorities and allocates resources. Like I mentioned, policies are often developed to address a specific issue or a specific problem. So again, we're trying to change something through policy. It's a mechanism for change. Policies shape our daily lives. We can have formal ones like seatbelts and speed limits and pasteurized milk, or we can have informal like social norms. Like I live in Toronto, and if you are riding on the subway and you go on the elevator, please stand to the right and walk to the left. That's not written down anymore anywhere. It's just an informal policy. Policy can happen at all kinds of different levels. At the governmental level, so municipal, provincial, territorial, and also the federal level. It can happen at regulatory bodies, within organizations, and even internationally in organizations such as the World Trade Organization. One of my favorite nutshell descriptions of what policy is, this comes from H. Laswell in 1936. Policy is who gets what, why, when, and how. Healthy public policy is kind of an offshoot of what policy is. Really what we're trying to do with healthy public policies is to improve the circumstances in which people are born, grow, work, and age. Remember that definition of policy is that it can change current or future circumstances. So what we're trying to do is use it as a tool to improve circumstances. Healthy public policy is a coordinated action that leads to health, income, social policies that foster greater equity. As health promotion and public health professionals, that's what our focus is on. Building healthy public policies involves a whole range of activities, and you're going to hear a whole lot about those both from myself and from Janet. It involves advocacy, establishing or implementing policy at all of those different levels that I mentioned at the governmental, local, national, international level. And part of policy work also involves identifying the obstacles or the barriers to healthy public policy and removing those as well. And we can develop healthy public policies across a whole variety of sectors. Yes, health, and also all of the sectors that have an impact on health. Housing, education, employment, transportation, taxation, child health, the environment. I could go on because every now and then I ask folks, can they think of a particular sector or area of work that doesn't have an impact on health? And no one has to date been able to identify one. So this is a slide from the wonderful Inga Pedra that I mentioned from Peel Region. And this talks about the kinds of policy instruments. So I talked about how policy is a tool to make change. And these are the kinds of tools that we have in our toolbox. And they're regulation, economic, and information, and sometimes called the stick, the carrot, and the sermon. This particular reference is from 2003, so it is still a fairly new one. And one of the things that is interesting about policy is that there is an implied level of coercion within all three of these levels, the carrot, sticks, and the sermons. And coercion is really when we, as the majority or the decision-making group, is trying to apply our will to the folks that we are hoping are going to make changes or make decisions as a result of what we're doing. And the level of coercion involved in these three levels is different and is something to be aware of. So sometimes we get questions about why in public health and health promotion we're looking at healthy public policy. Is that within our bailiwick? Is that something that we should be actually working on? And we have two main anchors for why we do this work in this field. The first is the Ottawa Charter for Health Promotion, which was written in 1986. And as a capital H, capital P health promoter, I live and breathe by the Ottawa Charter. Do note that it is a somewhat problematic document in terms of how it was developed and who was involved and who was not involved in developing that. And the 5 action areas still hold promise for health promotion interventions today. And one of those is building healthy public policy. And you can see that building healthy public policy is actually that dark blue line that goes all around everything else. And that means that healthy public policy is that anchor. It's that mechanism for change, to change the social conditions and improve those social conditions for people where they live, work, play, and learn. The other piece of documentation that anchors our work in healthy public policy is the Ontario Public Health Standards. And this particular version is from the latest one from 2021. And it has specific expectations related to healthy public policy in a whole variety of areas. Food safety, safe water, reducing exposure to health hazards, infectious and communicable disease, preconception, pregnancy, all kinds of different areas. The standards also talk about our role in equipping community partners to have the knowledge and the capacity to build healthy public policy. And the health equity guideline states a requirement that boards of health shall lead, support, and participate with other partners in health equity and healthy public policy work. So between those two documents, they give us a foundation, whether you work in public health or community health, or whether you work in an NGO, a non-governmental organization, our work is anchored in healthy public policy. So what does that work actually look like? So the National Collaborating Center for Healthy Public Policy did a scoping review in 2021, trying to look at the competencies for developing healthy public policy. And I present this as a way to illustrate what types of work healthy public policy can involve. So working in healthy public policy can involve doing policy analysis and developing policy. It can also involve influencing and advocating. It involves working in partnership and collaboration. It involves communicating. It involves understanding the policy context and understanding the social determinants of health, understanding policy theory, and providing leadership. There's a whole bunch of different things that go into healthy public policy work. And I'll look up the link for that for you a little bit later and paste it into the chat. It's a really interesting piece of work that the NCCHPP has done. Okay, so let's get into a few specifics here. This is kind of the foundational document that most of this information that I'm talking about is coming from. And we're also going to paste into the chat for you a link to the full workbook, as well as a shorter version called an at a glance that summarizes a lot of the information that I'm talking about in this webinar. And this workbook was developed by Dr. Kim Bergeron and the Healthy Public Policy Community of Practice in 2018-ish. And there are 3 embedded concepts within this piece of work. And that is the notion of health in all policies, which involves working with other sectors that influence health. Advocacy, because that is a very important part of healthy public policy work, regardless of whether you can call it advocacy or whether you have to use another term. And also health equity, because again, healthy public policy is aimed at changing the social conditions so that people have that opportunity to live healthfully. And in this workbook and in the at a glance, thank you for pasting the link into the chat there, you'll see this 8-step, 3-phase model for building healthy public policies. So I'm going to whip us through these steps fairly quickly. So the 3 phases are planning, implementation, and evaluation. And you can see that this diagram looks fairly linear. The steps are numbered, and they're numbered in order. That, however, is not always the way that it works. You also might spend more time in one step than in the other step, and you may actually have to go back and forth. So all of that stuff is very normal when you're talking about building healthy public policy. And what does that process actually look like? So the first step is to identify, describe, and analyze the problem. So you're looking at what the situation is, what can make that better and worse, and what can you do about it? What are those policy options? And once you've identified those potential policy options, you analyze them to get a sense of what is feasible, what is doable, what do I have community support for? Speaking of community support, in step 3, you're going to determine and understand decision makers and influencers. Who are those people? And what is their stance on this particular policy? Are there decision makers who are for or against? Are there influencers that can help you work with those decision makers to shift them towards the policy option that you're talking about? Part of that is also in step 4, assessing readiness for policy development. Is there an appetite in the community and public discourse amongst the people who are going to be approving or implementing the policy for this particular policy? Or do you have a lot of work to do to bring people around to the particular policy option that you are thinking about? Once you have done all of that work, it's time to sit down and develop an action plan. What are all of the steps that I am going to need to do in order to develop, implement, and evaluate this policy? And then we get to move on, hopefully, to the implementation stage, where we're actually implementing that action plan and we're actually facilitating the adoption and the implementation of that policy. The last step, which of course doesn't mean that you actually plan for it last, but it happens to fall last in the linear numbering order that we have here, is to evaluate the policy. And with all kinds of evaluation, you have a couple of different approaches. One is that you can evaluate the policy itself. Did the policy make the change that we wanted to see? You can also evaluate the process that you used to develop and implement that policy. So you can look at the particular steps that you took to work on this policy. Did it look like the plan that you had envisioned? Did you have to differ from what you were originally planning? Were there particular obstacles that came up? One of the things that I like about evaluating healthy public policy is that this work can take a real long time. If you just think about the work that tobacco control went through, some of those policies took 40, 50 years to actually implement. But when you're evaluating your process, when you're evaluating the steps that you took and the work that you did to get there, you're actually showing the deliverables of what you've achieved. That's not always the implementation of the policy. Hopefully it is. But to be honest, sometimes that doesn't happen within our work lifespan or within our lifespan altogether. So that was a fairly whirlwind journey through the 8 steps of Public Health Ontario's policy development process. Thank you so much, everyone. I hope that you enjoyed that little bit of background. And we're going to shift to the next couple of slides, and I'm going to pass the reins over to Janet, who's going to spend some time talking about her experience in building healthy public policy at her health unit, and also give you some pretty jazzy show and tell.
Wonderful. Okay, thank you so much, Andrea. That was a great overview of healthy public policy, and I really appreciate that. And I'm super honored to provide the case study for the webinar today. As I mentioned, my name is Janet Dawson. I'm a health promoter specialist specializing in policy and equity at Peterborough Public Health. I am a white, cisgender, third-generation settler, and I just want to respectfully acknowledge that where I am today is Treaty 20 traditional territory of the Mississauga and Anishinaabe. And if you're not familiar, Treaty 20 covers a very large area of Central East Ontario, and it's home to many significant areas that are used for food production, as well as bodies of water, rivers, and tributaries, and of course, very beneficial forests. And I really want to honor and offer my gratitude to the Indigenous people for their care for and teachings about the land that I am located on. And particularly my journey for reconciliation is to honor those teachings and to incorporate that into the work that I do. So I just want to express my gratitude for the unique history and culture and traditions of the Indigenous people who we share our time and space. So a little bit, this might be a little bit different than what you were thinking about for the webinar today. I'm not going to, I'm presenting a real life example of the steps that Andrea presented. So I'm not going to present to you about built environment policy. If you would like to read more about the work that we did on the built environment policy, we're going to put some links in the chat, and you'll be able to access two reports that Peterborough Public Health produced. What I'm going to present to you today is a case study about the process that we took. And the process spanned 5 years. And I don't want that to alarm anybody or put anybody off, because if my colleagues, anybody on the call today might acknowledge, we literally thought this was going to be a 9-month process. So this is definitely, it's when you think about those steps and the magnitude of some of those steps and how long implementation might take or evaluation, it can span quite a while. So this is a picture. I'll share with you a little bit of the context, as well as the window of opportunity. So I was excited to see that some of you really want to learn about readiness, because there definitely is a window of opportunity. The mandate for us to do the work, and then the steps that we implemented to get to the policy development process or policies being passed. So and I hope that many of you will be able to see kind of the journey that we took. But for those of you that are on the call today, I just want to highlight, you may not be familiar where Peterborough is located. We are one of 34 public health units in Ontario. We are a standalone Board of Health, and that's really important to recognize, because we are not embedded in the municipal structure in any way or the provincial structure in any way. So we are a standalone body, and we serve 10 local governments. That's 10 local governments that are either single tier, upper tier, or lower tier. And we also have a Section 50 agreement with 2 First Nation communities. So we do serve 10 local governments and 2 First Nation communities. So I'm going to take you back, if I can, to 2017. 2017, this is the context I wanted to share. So we were working on built environment and healthy community design work. And we really were, Andrea, I had to laugh when you said that, because we were in step 1. We were in a perpetual step 1 where we were assessing the issue, trying to understand, we were looking at the data, looking at the evidence, and we really were addressing this from 4 standards, from the program standards and foundational standards. So we were looking at it from a substance and injury point of view, a little bit of healthy environments, chronic disease prevention. You know, we were definitely doing that physical activity, active transportation kind of view of healthy community design. And I can't highlight enough about the partnerships and collaboration. At the time, we were really looking at, you know, who could we partner with, what kind of groups could we collaborate with, but it was really trying to understand the issue. And policy work, all those other steps were not really on the horizon. It was definitely a project that we wanted to move more into that policy realm. but there wasn't exactly that wonderful window of opportunity. And then the window of opportunity came, whether we were ready for it or not. The city of Peterborough had not done a complete official plan review since, get ready for it, 1982. So they had done a stop-start kind of thing. So why it says relaunch there is they officially went into, we're going to get this going again, official plan review in April 1st, 2017. And then coincidentally, they're not the same municipality. City and county are not related. One's a single tier, one's an upper tier in a two-tier system. And the county launched their official plan review in 2017 as well. So a huge window of opportunity was presented to us, and we could really launch into this policy development process. And so we really needed to figure out whether we had the mandate to do this. We have the evidence. We had been working on that. We had been working on looking at some of the data. We have now a policy window of opportunity, but do we have the mandate, and do we have the ability and capacity internally as an organization? So we, of course, I like how Andrea included the public health standards. We go right to the public health standards, and there is talk of healthy public policy in a variety of places, but there is also the Healthy Environments and Climate Change Guideline that states that boards of health shall collaborate with municipalities to review local official plans. So we did have that mandate, but we also recognize that this is reviewing official plans in regards to health hazards and climate change, and we wanted that broader scope. And so I also wanted to highlight the additional mandate that we have, which Andrea pointed out as well at the beginning of the webinar, that when we're looking at our Ottawa Charter, which is our foundational document, we have the healthy public policy is a huge component of the health promotion strategies that we would use. But we also have to remember that we have the public health roles for health equity, and public health roles for health equity are 4 components to incorporate health equity into all the work that we do, regardless of which program standard you are working on. And we have participate in policy development. That's an important role to remember. And then at Peterborough Public Health, when we look at our mandate as an organization, we have advocacy built in right into our strategic plan. It is one of the founding components of our strategic plan. So we wanted to make sure we were acknowledging all those foundational documents and the work that we do. So we've got the policy window, we've got the mandate. Does that make this work automatically easy? Well, I would say in the beginning, or if we were to just look at a quick snapshot of the work that we did, it looks a little bit like the turbulent flow diagram from NCCHPP in 2013. So we as I mentioned, we were thinking that this was originally going to be, a 9-month process. We started out with the city. We didn't realize the county was going to jump in there a month or 2 later. We also didn't realize that there were going to be some slowdowns with the process, with the government changing land use policy provincially. So that then has a trickle-down effect to change the municipal process. So we had some slowdowns there. And then in the middle of it all, there's a pandemic thrown in. So who saw that coming? So there was definitely, it felt like a turbulent flow, but this diagram isn't very appealing to make to me, and it doesn't make policy work look appealing. And since I'm a health promoter specialist in the field of policy, I definitely want to make this work look appealing to my colleagues. So since it's part of my job to build policy capacity across our organization, I set out to make some sense of the work that we did, and I'm going to share that with you today. So when we take a look, what I did was I took a retrospective look at all the activities that we completed in the 5 years, and I categorized them into themes. So yes, we had planning, implementation, and evaluation. We had those nice 3 clear buckets. But then we did a little more of a granular look of the activities that we did over the 5-year window, and I'll show you in a little more detail. But we had 8 steps, but our 8 steps were a little bit different than what Health Promotion Ontario had proposed. Were they drastically different? Well, we did a little bit of data visualization for you so you could see this, and I'll show you in the next few slides, but they were slightly different. You can see there were 5 steps under planning, 2 under implementation, 1 under evaluation, which is the exact same as the Public Health Ontario process. But did it follow the nice, clean, 8 linear steps of Public Health Ontario? Well, let's take a look. And what I am pleased to show you is some work that we've been doing as I mentioned, in my role to build capacity, policy capacity across the organization. I worked with an epidemiologist and we implemented the activities that we did on this policy process into Power BI. So I'm going to share with you right now my screen. And I want to show you a little bit of this process in Power BI so that it visualizes a little bit more of the policy process that we used. And we can actually look together and see whether we followed a nice linear 8-step process. Was it swirly whirly? And also what's important to me, and I'm sure many of the managers or coordinators on the call, how much time do you need to budget and spend in each step? And I will caution that does depend on the policy process. So what you can see here is a nice linear process. We started, the events on the screen just indicate an event for the official plan process by the city or county. So you can see here when I drop down the events, you can see like the launch of the official plan, the launch of the first draft that we commented on. You can see those nice events. So our work coincides with that. So you can see at the bottom of the screen, we color coded all of the 8 steps. So when we break it down into planning, implementation, and evaluation, it looks like a nice linear process. Let's take a look at planning. So we drop down planning. Planning, as you can see, is, and I'm going to go to a different slide so you can look at it, but you can see it doesn't go from one color to the next color to the next color. There's colors all over. So that means there's various steps happening here. When we add in implementation, you would think that the planning, then implementation naturally follows planning. Well, you will see that planning actually gets interwoven with, implementation gets interwoven with the planning activities. And I'm going to talk a little bit about that. So you need to we had to take every opportunity that was presented to us to comment on official plans, to advocate for our position. So remember, we're a standalone standalone health unit. Built environment policy changes happen with the municipality. We do not hold, as a health unit, the key to built environment policy. So anytime there was an opportunity for us to advocate for our position, state what policies we were looking for, we needed to take that. So even in the nice planning stage, we are advocating, we are analyzing the evidence. New evidence would be presented. We would need to pause our process and take time to analyze evidence. So as you can see, what we did was we put this into a timeline just to really get a sense of the work that we are doing. But for those of you that on the call that really like numbers, I maybe will just take 1 minute and show you the quantitative. So what I wanted to do was I wanted to break down this work to see how much time were we spending in each step. So this might be a bit of a busy slide for you, but I'm going to walk you through each of the slides. So as you can see in the top right-hand corner, the pink graphs, I wanted to see when were we really doing the bulk of our work? Well, you can see in 2017, there was a lot of planning work, and we were trying to get an understanding. We were trying to learn built environment policy. So you will notice one of our steps is internal capacity building. And we were trying to analyze more of the evidence. And then, as you can see in 2018, we started to get a little more, and I'm going to click on it so you can see it pops out the activities and the other graphs. We started to get in a little more implementation. I don't think it comes as a surprise to you that there was no work done in 2020. Anybody on the call likely knows why. Now, I would say evaluation, if I could say a bit of a disclaimer, really should be sprinkled out every year. We really need to start building our evaluation capacity for policy and for all work that we are doing. But we didn't. We were so busy with creating our plan, analyzing the evidence, taking those policy windows, doing the advocacy, that we didn't start to really think about building that evaluation capacity. So after the pandemic, when capacity was very limited, we started looking at evaluation, and that's why you see a whole chunk of evaluation work that happened in 2021 and 2022. But if I could change things, you would see that dark red sprinkled throughout those years. So I would just want to draw your attention quickly to the top left, the donut graph. So here is that numbers and cents I was talking about. So you can see the percent roughly of the activities that we did in each of the categories. And it doesn't come as a surprise that action plan development is such a large component, because every time we made a change or every time there was something new that came our way, we had to go back to the action plan and do some changes to the plan. We actually had monthly check-in meetings as a team. There was 13 staff that worked on this project, and we had monthly check-in meetings to look at the plan, talk about our actions, and then reconfigure if we needed. So you can see every time we had a check-in meeting, it created an activity on our timeline. And you will also, I think, be a bit surprised to see that advocacy has the next largest percentage. Not by much, you know, public health really likes to analyze the evidence. And so we did a lot of analyzing the evidence, but advocacy was up there. And I'll maybe talk about that a little bit more with Andrea in a minute. But one of the stops on the Public Health Ontario process isn't knowledge translation. We called one of our steps very purposely knowledge translation, because we are trying to convince people not in the health sector why policies that impact health are important. So we had to do a significant amount of knowledge translation. And that was, when you think of 13 staff, when they're going to meetings, they were presenting about this work. When we were going to a meeting about climate change, they were maybe about climate change. Oh, they were hearing about this work. So knowledge translation was a significant portion of our work. So I think what I'll do is I'll just stop there. I know Andrea and I have a little bit more to share in a Q&A portion that we've put together, but I just wanted to show you, illuminate for you, if you will, our policy process and the steps that we used and how much time we dedicated to each of them.
So Janet, when you first showed me all of this marvelous Power BI stuff, I went, ooh, and I just imagine everyone at their computers going, ooh, every time you click on something and the fields change. What a marvelous tool. And if you're anything like me, I had to Google what Power BI is. And it's a Microsoft tool. And data visualization is obviously what it does. And I bet you can all imagine, I bet you're all imagining implications right now as you're looking at all the work that has been done. So Janet, I was really struck by the effort that you and your health unit colleagues spent in building internal capacity at your health unit. Why was that internal capacity building, building the skills and knowledge and self-confidence, why was that so important to your work?
Yeah, great question, Andrea. And I'm going to flip to the third slide here because I think it illuminates it well. An internal capacity building is not something that is in the 8-step process as well for healthy public policy. But when we break this down, so let me break this down for you. We're going to look at the planning, implementation, and evaluation of the work. Okay, and I'm going to really focus on the planning phases. So when we break this down, we intentionally added internal capacity building. So when I hover over the legend, can you see those boxes that are popping out in the red? So that's internal capacity building. And we added this in because we are taking public health experts and we are commenting on policy that's outside our sector, that's in the land use planning sector. And we are trying to advocate for policies that are how communities are built that will inherently build the positive health outcomes into healthy community design. If anybody comes across an easy manual that says which policies you need to do that, please send it my way. But we looked and it doesn't exist. So we needed to do some internal capacity building. So we built in an intentional process for, and what we called it was a learning journey. And the staff, we took, it was, I think 6 weeks, which was pretty rushed. To build in an intentional learning journey. And we had a facilitator come in and work with us. We had designated readings everybody was to do. We also had fireside chats with each other to talk about what we were learning. And so it was really a designated process in the entire policy plan where we could build our competency in being able to talk the talk of land use planning.
That's amazing. The other question that I wanted to ask you, and again, you probably heard everyone going, ooh, as you were clicking through Power BI there. I wanted to ask you about the word advocacy, because sometimes in public health and health promotion, it's kind of a tricky word, and you very clearly laid out the 3 foundational documents that give you the rationale for the advocacy work that you're doing. But when we break advocacy down into activities, what did that actually look like? What did you actually do to advocate?
So I love that you've teased out this advocacy. So I'm going to hover over the advocacy so you can see the advocacy work. And advocacy does get a bad rap, I think, but it is so important that we build this into our policy development process, particularly if you are advocating for policy that's outside, or if you're needing policy, not advocating, if the policy change that you need is outside the health sector, which many of the upstream policies that we need to change are outside the health sector, then advocacy has to be a foundational component of your plan. So your advocacy is looking at how you will sway the decision makers or how you will convince the decision makers that these policy changes are needed. So you will see advocacy is in our timeline a number of times, because we were going to meetings external to that health sector, talking about our positions, talking about the data, talking about the analysis that we had made, and why it's important that we need trees and parks, or why it's important we need community gardens, why we needed community hubs for recreation, or why we needed them for food development or production. We were talking about walkability. We were talking, so we were at those tables talking in language, because of our internal capacity building, talking in language that those stakeholders knew. But again, we were advocating for policy change that will have health outcomes.
So it sounds like a lot of the work that you were doing comes down to talking and relationships. Like I'm struck by how much of your work involved talking and how much of your work involved building relationships, like one-on-one coffee meetings and going to meetings and talking and talking and talking. Why is that so important, those relationships? How did you leverage those in the work that you were doing?
So I'm going to hover over relationship building for a minute, and it doesn't really pop out at you because there's only 4. So I just want to say a little bit of a disclaimer. When we were analyzing the steps that we took, so doing the retrospective view, the activities we chose as one category. We put it into one category. Arguably, I would say all of these advocacy categories could also be relationship building categories. Relationship building is so key. And remember, I said to you in 2017, that's when the window of opportunity came. What I should have done is done a timeline for you back to about 2013. Because in 2013, we were doing a lot of work on active transportation. But in that period of time, we knew from 2015 to 2017, we needed to broaden our horizons beyond active transportation. Active transportation seems to be the easy window into land use planning, but we needed to talk broadly about bigger things. And so what you're doing when you're going outside the health sector is you're trying to tell experts in their sector why they need to do a policy that they're not knowledgeable about. They may not be knowledgeable about. You're trying to tell an expert of land use planning to do a policy that they not feel comfortable doing. Or let's talk about misinformation out there. Let's think about the misinformation about 15-minute neighborhoods right now. So if I'm going to a meeting and I'm all of a sudden, who is she? And she's talking about 15-minute neighborhoods, they might not, trust, or I might not have the credibility. So if I could expand this timeline, I would put in all of the relationship building activities that happened between 2013 and 2017. And you would see relationship building would quickly win the race on the steps, because there were numerous times where we were out meeting with people, building relationships, building credibility, building trust.
Thanks, Janet. So the last question, or the last thing I wanted us to talk about, and both of us alluded to this, is that the PHO policy model looks very linear, and the work that you were doing looks way swirlier. The NCCHPP turbulent flow, which I absolutely adore. What did your analysis show about the time horizon? So how long did all of this take?
So
is it still going? Yes,
it's still going. It's still going. And unfortunately, not as great a capacity. We've had this pandemic thrown in there, and public health priorities have shifted. But if you, and I like how you added in earlier when you were talking about the 8 steps. So what you see on your screen is, up to 2020, we had full-on resources on this project. We had 13 staff, 3 managers, we had support working with us. And it wasn't full-time staff. These were some of these staff, this was kind of done on the side of their desk because they were so busy with other things, but we had that policy window. And so why we broke this down was to, the policy development process is a bit gray. And I think there's a lot of people in public health that like black and white. And I want to make sure people understand that it is a bit black and white. I know there's gray thrown in there, but we do have some designated steps. They might come a little bit before one another, but generally speaking, in public health, we are analyzing the data, we're building the relationships, we're understanding who the decision makers are, we're using the opportunities that are presented to us. And that may change the flow of what we like about it. But generally speaking, we are planning, we are implementing, and we are evaluating. And that's what our process followed. And but like I said, we did have some slight tweaks to the 8-step process because we're a standalone Board of Health. We have advocacy in there. And because we're advocating to an external body, we have capacity building in there. But I just wanted to, I thought it was important when we illuminate the process and we use Power BI to do that, it does follow a pretty standard process.
Yeah, and I think if we took the time to map your 8 steps onto PHO's 8 steps, we probably could do that. But I think what's important is recognizing that not all policy work looks the same and not all steps are the same. And, we did have someone, I just have to say in the Q&A chat, that felt extremely validated when you talked about the knowledge translation work, and that isn't in PHO's steps. So there are things that are important according to your community and the work that you're doing that might not be in someone else's process, but that doesn't mean it's not important. So thanks, Janet. We've got lots of great questions coming in. So I'm gonna pass the reins over to Dan to shepherd us through some of those awesome questions.
Wonderful, thank you. Yeah, lots of great questions are coming in. Please continue to put them into the Q&A pod. But I wanted to start by saying 1982 was not that long ago, folks. I just wanted to put that out there as a elder millennial. I just wanted to really reinforce that. But Janet, thank you for mentioning that, how Peterborough Public Health is structured, because I think that's really great context to share with folks that it is an autonomous board of health. For example, I worked in Halton for a number of years and doing tobacco work, and real quick, we were able to get a 9-meter rule in every regional building in Halton with some youth advocacy. So again, it kind of depends on the context of where you are and who you're working with and who your partners are. But it's very different across the province. And that's something I tell students and new grads all the time, which leads me to one of the questions that's come up is, like, if you're getting into policy work or you're curious about are there community practices, how can you get more involved in policy? What are some recommendations that you would provide or suggest for either new grads or people trying to get more policy experience? And maybe Andrea, you can start, and then Janet, you can add on if you like.
Policy experience is a great question. I mean, one of the things I want to mention is the National Collaborating Center for Healthy Public Policy. Their website, I mean, they are our go-to shop for all things policy, including ethics and competencies and all kinds of great stuff. So they're great to look for resources. If you are wanting to transition into the policy space or want to get some experience in doing policy work, I'm pretty sure there are organizations in your community that would be real appreciative of some time and some effort in doing some policy work. One of the things that I would just say is do take the time to make those connections as opposed to starting something off on your own. I'm not saying you would do that, but make those connections and see who is around doing some policy work that you can get involved in. Janet?
Yeah, I think that's a great idea. I also think it's interesting. It's also learning that critical eye in your work. So it's reading the newspaper and not being like, oh, look, where interest rates are going up again. It's why is it going, what policy lever are they using here to have interest rates go up again? Or it's looking at, reading the newspaper and they're talking about the opioid crisis, and it's thinking about why is that happening? What policy levers could we use to change this dialogue? It also, another portion of policy work with the critical eye is trying to understand the misinformation and disinformation that is circulating. So that's a huge component now of our work that we're doing when we're thinking about readiness and we're thinking about decision makers. So, thinking about what kind of dialogue are they using? Are they using dialogue that might not be in the same light as public health? In Peterborough, when we were working on our active transportation work, we had a counselor that talked about a massive street going through Parkland as a complete street. It completely using the wrong context. So you had to think, okay, if I use complete street, this counselor is going to think about this massive roadway. And so that was work we had to budget into our timeline, was to, okay, we have to correct, what is complete street? We have to do that kind of education and tie complete street to health outcomes. So I think if I could say, if you're not working in policy, using all those opportunities to develop your critical eye, and thinking about Andrea's land acknowledgement at the beginning of the presentation, the two-eyed seeing. So that's the Western way and the Indigenous way, and building that into your professional practice.
Awesome. I also suggested to students, like, you can start small. You can start at like a community health center or like a nonprofit or an NGO. Like, you don't need to start working for the province right away and jump into capital P policy work. So I think any kind of change or advocacy or those capacity building pieces would be helpful. And as you mentioned in the presentation, it takes a long time to make policy change. So those are great things to remind people of. There were lots of questions around KT and advocacy. Did you want to expand on any of those pieces around how knowledge translation can be useful to provide information and sway decision makers, or more information about advocacy that you want to elaborate on?
Yeah, I can jump in, Andrea. So remember, if you're building knowledge translation is so important, because health, I can't say how many times in my career where we have our own dialect, we speak our own language, and all these upstream policies that we need to address or develop are outside our sector. We really have to learn to talk the talk of other sectors, or explain our information in a more understandable way. So Power BI, here's an example of taking a very boring, this is what we did, and then this is what we did, and then this is what we did, and we decided to illuminate it in a data visualization tool. So using tools that are available to you. The epidemiologist that helped me with this Power BI was amazing. Like, again, taking my boring chart and helping illuminate it. So all those kinds of ways to tell the story, and that relationship building, playing that key component with the advocacy and with the knowledge translation. So the more people we can get outside the health sector saying our key messages and saying the positions that we are advocating for, the better, because that means the decision makers are hearing it from multiple angles. So that knowledge translation is key. If you're going to the seniors clubs and you're talking about why you are advocating, or your position, what your position about, and then all of a sudden they're picking up and they're like, yeah, that makes sense. And then they start talking about that. And then you're going to your youth groups and you're explaining, and they pick it up and they're like, yeah, we really like our parkland, we want to keep it. And then they are then advocating for what you're doing. So it's the knowledge translation component is really important.
Nothing to add there from me.
Awesome. Great. We have about 10 minutes left. In a minute or two, people are going to see a poll to come up, and I'm just going to remind you that we're just kind of capturing some feedback on how you like the format of today's session. So you can kind of answer that in these last 10 minutes, but we're going to get to a few more questions in the meantime. So thinking about like policy development, implementation, evaluation timelines, but then comparing that with reporting and funding cycles, and how you evaluate and measure all those things at the same time that are sometimes tied to political pressures. How do you manage all that? How are you taking your big Power BI graph and kind of letting people know that you're making work happen, or you are addressing those changes?
Just a little question,
This is still an easy one. Okay.
It's the big question, isn't it, Janet?
Yeah, I can. Do you want to tackle it?
No.
Okay. Well, I would say, so it's a great question. And I would say that's why it's helped that when we did the retrospective view of the work that we had done, you look at the big buckets, the planning, the implementation, the evaluation, we were making peanuts of progress when you look at the big scale 3 categories. So it's kind of a bit of an interesting, because the people that like black and white, it's easy to stay in planning, implementation, and evaluation, right? Because you're kind of in one, then you flow into another, and you flow into another. But the people that, so it makes you feel a little uncomfortable if you like black and white to move into the more granular steps, because that's when they get swirly whirly. I like how that's become a trade term for this webinar. But what's important about the granular steps is that then you can show progress a little bit easier. So, if you're trying to say to your Board of Health, what kind of progress are you making on this? We're putting in copious amounts of HR resources, funding. What kind of progress are we making? So the granular steps allow you to show progress a little bit better. And then I would say what's really important on your timelines is to show those wild cards. I call them wild cards. We did not see a pandemic coming. So, would our process have been 5 years? Well, there's a lot of change at the provincial government level too, with land use policy, and the municipal official plan process was stalled because the government changed some of that policy, and we didn't see that coming. So make sure you're mapping your wild cards too, because then that shows, okay, we really wanted to do internal capacity building, and then we wanted to go into analyzing the evidence, but there was this policy window, wild card, and we went right into advocacy. And then you can explain to your funders why.
Just to build on that, I think that sort of documentation component and that process evaluation component is really important here. And it probably sounds a little bit of a wild statement when you have a lot of things to do, to sit down and write down everything that you've done. And I don't think that it needs to be that big a deal. I'm a visual person, so one of the things that I often like to do with big projects, and policy is a big project, is I'll just unroll a big sheet of paper and stick it on my wall and start jotting down those milestones. So when you're planning in step 5 of PHO's process, if that aligns with the work that you're doing, remember to actually identify those milestones. And also remember, this might sound a little wild too, that implementation of the policy might not be your end goal, okay? So, I mean, we want it to be, but you're going to have other significant things that happen before you get to that implementation. And you need to have a sense of what you're looking for so that you can document it. You can write it out on your timeline. I love the wild cards. I've never even thought about that before, but if we've learned anything in the last 3 years, we've learned that those are a thing.
Awesome. I love how people are sharing resources in the
Awesome.
chat as well. Thank you for doing that. Swirlier Wildcard is going to be a new theme park ride that I'm going to design. I'm excited for that. There's a question in the chat that kind of builds on what you're just mentioning, and it's like, how do you know you're ready to move forward with the start of implementation? So is it kind of getting to those milestone pieces and saying like, we got this far, we've done this much work? Or are there times that you need to kind of have more formal tools or criteria to really move forward?
I'm going to jump in with that one, Janet, because it depends on what you mean by implementation. Do you mean implementation of the plan that you developed to build the policy, or do you mean implementation of the policy itself? So I think you need to be real clear about which type or all types of implementation that you're talking about. Janet?
Yeah, it's a great distinction. And so implementation of the policy that you're advocating for obviously will depend on who's the holder of the policy. So, if you're, that's why our original look at our work was Swirly Whirly, because the person who holds the cards on the process is not us. It's kind of uncomfortable. It was the city and the county. They were dictating the timelines. They were saying when the time was to provide input. They were the ones calling the meetings. So you do have to, so sometimes some of your work won't be ready. And that's when internally you're going to decide whether we're ready to participate, we have enough to go by to participate, or whether we're not ready. And maybe that's where it comes down to, do we have enough evidence? Have we used a health equity lens here to make sure that we're not asking for something that's going to impact any type of population that we serve? Do we have the mandate? Do we actually have the mandate to go and be asking for walking paths? Yes, but depending on where, so it's those kinds of tools that help you do the analysis as to whether you're ready to move forward. But if it's related to the policy implementation, I would say 9 times out of 10, that policy is outside our scope, and that's dictated by somebody else.
Great. Okay, I'm going to give you 2 questions because I want you to think about the first one for a while you answer the other one. and I don't know who asked this, but it's very much a Dan Johnson question. So what is your single take-home message today? So think about that for a second. And then the second question is just talk a little bit more about Power BI. Are you able to share it? What version are you using? There's lots of interest from folks out there around Power BI. So do you want to talk about Power BI real quick and then kind of some bigger take-home messages?
I can talk about Power BI real quick because I don't know which version. I do apologize, but I can get that answer for you. Power BI is something that our organization is starting to use for knowledge translation and data visualization. So you can go onto the Peterborough Public Health website. Power BI actually, we launched our first Power BI data chart in the pandemic when we needed to visualize COVID rates. And there was a lot of information to share, and, vaccinated, not, yes, no, maybe, all that stuff. And it was quickly becoming 14 screens that you had to scroll through. And so Power BI gives that really nice ability to, in one screen, look at some data, provide some explanations on the side. And so that was kind of a cool experience for us. And then so it's definitely, our epidemiologists are using it a lot more. And on our team, on our foundational standards team, we've started talking about how we could use Power BI to illuminate other types of work. And so we piloted this. And Andrea is so right, write down all of your steps. Think about the process you're using. Think about how you're categorizing your work, where you're putting your energies. And then we were able to illuminate that using Power BI. And so we're hoping to use this a little bit more. This project was just a pilot that we decided to share publicly with on a Public Health Ontario webinar, but we're hoping to use Power BI a lot more internally to illuminate the kind of work that we do, or even really hard to understand concepts. And then they obviously give you a product that you can share publicly.
And that last big question.
I can go first since you were talking, Janet. And I don't know if you can think and talk at the same time. Sometimes I can and sometimes I cannot. I am going to quote Hitchhiker's Guide to the Galaxy for my piece of advice, and Dan is nodding because he knows exactly what that means, and that is don't panic. In large friendly letters. This is a real big piece of work. And of course you're going to be panicking at times, but just really take a breath and keep your eye on the prize. I'm just going to throw out a whole bunch of wild sayings here, and work with people to help keep you calm, but also to work towards the goal that you're trying to achieve, which is that kind of change in your community to address the social conditions. And
I'm going to say, you don't have to have all the answers. Public health likes to have all the answers. We love it. Like, we analyze, but you don't have to know all the answers. And so that's where that internal capacity building was so important for us, because we didn't have all the answers, and we still don't have all the answers. And sometimes, building on relationships, I call the external people and I say, I see this in my health data. What do you see at your land use planning and data? And we end up seeing the same thing. And then we talk together and we come up with the solutions together. So you don't have to have all the answers.
Fantastic. Okay, thank you both. We're pretty much at time. So as we wrap up today's session, I would like to thank you both, Andrea and Janet, for presenting. I want to thank everyone who joined us for today's webinar as well. You can expect to receive a brief and anonymous survey for today's session. Please try to complete this to help us improve our programming. And lastly, to access past presentations and view confirmed upcoming sessions, please visit the PHO website, head to Education and Events, and click on Presentations. Thanks, everyone, and have a wonderful day.
Thanks, everyone.
Thanks, everybody. Good luck on all your policy work.